Hi students. So in the last class we learned about diagnosis under nursing process. So we have already finished two steps, that is assessment. The first step was assessment. The second step was nursing diagnosis. And now we are heading towards planning, the third step. So what is planning? Planning is a deliberative systematic phase of the nursing process that involves decision making and problem solving. So it is the deliberative systematic phase. Okay, systematic phase in the sense according to the need of the patient. Okay, what are the care you can provide, and those care comes according to the priority. Okay, so according to the priority, so it goes systematically. So systematic phase of the nursing process that involves decision making and problem solving. So there will be decision making. So according to the priority, you have to provide care. So you will decide which is the priority and then solve the problem of the patient. So it is the deliberative systematic phase of the nursing process that involves decision making and problem solving. So, formulating client goals and designing the nursing interventions required to prevent, reduce, or eliminate the client's health problem. So, it is the formulating the client's goal. You're formulating, that means you're planning or you're forming the goals and designing the interventions. Okay, what are the care you're going to provide? That is nursing intervention. Whatever desire or care you're going to provide required to, which is required to prevent the problem or reduce the problem or eliminate means stop completely, eliminate the client's health problems. So that is the planning. Okay, so under nursing intervention, any treatment based upon clinical judgment and knowledge that a nurse performs to enhance patient or client outcomes, product of planning phase is a client's care plan. So what are the types of planning? So first one is the initial planning, ongoing planning, and discharge planning. So you have three types: the initial planning, the ongoing planning, and discharge planning. Initial means beginning. Ongoing means after beginning the planning, when the patient is there in the hospital, admitted in the hospital, those are the ongoing planning. And the discharge plan, when the patient gets discharged, what are the planning you're going to what are the care you're going to advise the patient? That is the discharge planning. The planning process. So, setting priorities, establishing the client goals, the desired outcome, selecting the nursing interventions, writing individualized interventions on care plan. So, first and foremost, as I've explained in the beginning, you're setting the priority first, then establishing the client goals. Okay, then selecting the nursing interventions. So what kind of interventions you are going to provide? So that is a nursing intervention. Then writing individualized interventions on the care plan, writing those things on the care plan, because this is the planning step, isn't it? That is why writing the individualized intervention on the care plan. So in detail, we will see what is the setting priorities. So priority setting is the process of establishing a preferential sequence for addressing nursing diagnosis and intervention. So it is setting the process of establishing the preferential sequence. So first is the higher priority, then comes the medium priority, then comes the low priority. So nurses use frequently Maslow's hierarchy of needs when setting the priority. I hope you know what are the Maslow's hierarchy. That is the basic needs of the patient, which is been divided according to the priority. Then setting the factors affecting the priority: client's health values and the beliefs, client's priorities, resources available to the nurse and the client, urgency of the health problem, and medical treatment plan. So establishing the client goals. So goals or desired outcomes. Nurse hope to achieve by implementing the nursing intervention. There will be expected outcome. There will be predicted outcome. outcome, criterion, and objective. So goals are broad statement of client status. So desired outcome as more specific observable criteria. Okay. Then, establishing the client's goal is continued. Purpose of desired goals and outcomes provide direction for planning the nursing interventions, serve as a criteria for evaluating the client progress, enable the client and nurses to determine when the problem has been resolved, help to motivate the client and nurse by providing a sense of achievement. So, these are the desired goals and the outcomes. Okay, so let us see what is this short-term goal and the long-term goal. So goals are again divided into the short-term goal and the long-term goal. Okay, so components of the goal is subject, verb, okay, then condition or modifiers, criterion or desired performance. So subject is a noun. It is a client, any part of the client or some attribute to client. Verb is the verb specifies an action the client is to perform, that is, show, walk, and drink. Conditions or modifiers, these are added to the verb to explain the circumstances under which the behavior is to be performed. For example, walk with the help of a cane. Okay, then criterion of the desired performance. The criterion indicates the standard by which performance is evaluated. That is, for example, then establishing the client goals under that. So client, the verb, say drinks. Condition modifier is 2500 ml of the fluid. Then guidelines for writing the goals and the outcomes. What are the different guidelines? So client centered, singular goal and outcome, observable, measurable, realistic, time limited, mutual factors, compatible. Make sure the client considers the goal is important and valuable. So these are the guidelines for writing the goals and the outcomes. So what are the nursing interventions? How do you select the nursing intervention? So nursing interventions are the actions that a nurse performs to achieve the client goals. So nurse chooses the interventions to treat the signs and symptoms like pain and anxiety. So intervention for risk nursing diagnosis should focus on measures to reduce the client's risk factor, because these risk factors will not be, the problem will not be seen on the patient. You being the nurse is anticipating that it might occur. Suppose an infection. The patient is getting a catheter. Okay, catheter is inserted, and every day the urine is been passed through the catheter. So you know, being the nurse, that there are possibilities that the patient might get infection in that area. Okay, because the tube is inside, and there is no proper hygiene. So you are anticipating that the patient might get infection. So your nursing diagnosis will be a risk for infection. So the intervention for this nursing risk nursing diagnosis should focus on measures to reduce the client's risk factors. How? You will provide personal hygiene for the patient. Okay, you will give the catheter care and the perineal care to the patient so that the infections will not occur in that area. Okay, then types of nursing interventions. You have the independent interventions, and collaborative interventions. So, independent interventions are those activities that nurses are licensed to initiate on the basis of their knowledge and skill. So, independent intervention means the nurse can take her own decision to provide the care in for that particular problem, like the physical care, that is providing the hygiene, maybe the bath, or you're providing the perineal care or catheter care. Okay, you're cutting the nails, then you're providing cold sponge, sorry, the tepid sponge. Okay, so these are the few things that you are providing independently. Then teaching and counseling. Okay, you're listening to the patient and you're advising the patient, okay, that you should to eat this much, you should sleep at this time, and you're being a nurse, you know the medical uh, information, so you're providing that information to the patient. Then emotional support, okay, then ongoing assessment, then making referrals other healthcare professionals. So these are the different interventions you're providing independently. Okay, ongoing assessment means you're checking if the suppose if the patient is bedridden on his back, there are possibilities that the patient will suffer from bed sores. So ongoing assessment is every day. Okay, very often you will be checking his back, okay, whether there is any signs and symptoms for the bed sore. That is the ongoing one of the ongoing assessment. Okay, suppose if the patient is having fever, okay, so he's come with a fever, so ongoing assessment you will be frequently checking the patient's temperature. That is ongoing assessment. Then making referrals other healthcare professionals. Okay, referrals to other healthcare professionals, it's not seen in every hospital, but some of the hospital, the nurses take the initiative to collaborate with other health team independently. Okay, then dependent interventions are activities carried out under physician's order. Okay, you're not performing independently, but by after physician's order you are carrying out that uh, care. So medications, treatments, IVs, diagnostic tests, okay, and diet and activity. These are the things that is prescribed by the doctor and you are following it. You are providing it to the patient. That is the dependent intervention. Collaborative interventions are the actions the nurse carries out in collaboration with other health team members such as physical therapists, social workers, dietitians, and the physicians. These are the actions a nurse carries out in collaboration with other health team members, such as physical therapists, social workers, dietitians, as well as the physicians. Then, criteria for choosing the nursing interventions. So, it should be safe, appropriate for individuals' age and health condition, achievable with the resources available, congruent with the client's. Safe, appropriate for individuals, age, and health condition, achievable with the resources available, congruent with the client's values, beliefs, and the culture. So these are the different criteria for choosing the nursing interventions. It should be achievable with the resources available. What are the resources available? Among that only you're supposed to provide the care. Then congruent with other therapies. Okay, like now physiotherapy. Okay, physiotherapy is one of the uh, I mean, it is one of the common therapy that has been provided in the hospital by the physiotherapist, especially for the accident cases like fracture or if the patient is having any respiratory diseases, physiotherapy is required. So the nurses should be collaborative with these physiotherapists. So it should be congruent or should be related with the other therapies. Then based on the nursing knowledge and the experience, so according to her knowledge, okay, and according to her experience, the intervention she will do. Then written established standards of care as determined by the state law, professional association policies of the institution. So in these several hospitals there will be different policies. For example, a simple example, if I can give you, in some of the hospitals, what time the bed making has to be done, what time the medication has to be given, and TPR checking, temperature checking. There is a timing. So in that timing, like 7 o'clock bed making, then again 8 o'clock medication, then 10 o'clock bed bath, like that. There will be different policies for in the hospital in providing the care to the patient. So according to that, you have to follow and plan. And then written individualized nursing intervention. So after choosing the appropriate interventions, a nurse will write them on their care plan. The format of the written intervention is verb, condition and modifiers, and plus time element. The action verb starts the intervention and it must be precise. Then relationship of nursing intervention to the problem statement. So observation, prevention interventions, then treatment, as well as the health promotion interventions should be added in the intervention part. Then nursing intervention classification. So this was first published in 1992 and been updated every 4 years after them. So that consists of 3 levels. The level 1 domain, level 2 are the classes, and level 3 are the interventions. Okay, so these are all linked to the Nanda. So these are the different domains. Okay, so physiological, basic physiological needs, and that basic needs, complex needs, and the behavioral care that supports the psychosocial functioning, then safety care that supports the protection against harm, then family care. Okay, as well as the domain 6 is health system care that supports the effective use of the health care. So these are the different levels. Okay, so that's about the planning. So these are the intervention. Okay, so this is about the planning. I hope you all have understood. Suppose if you have any doubts, please ask me. Thank you.